If only people could feel what I feel through the camera. Because it's like a guitar string.
Is that painful?
A little bit. It literally feels like there's a lima bean inside my...
It's like...
Probably even bigger than a lima bean.
But it's like a long string.
Like
it's like a cable wire.
Chocolate-covered almond is inside my hip.
Why dark chocolate?
The reason why it's really painful is it's right on my hip bone. It's like, that's the bone right there, right?
No.
That's not?
No.
Behind it, it's not?
Well,
that right there. Yeah,
up there is
like
your hip.
right.
But in here is like where your joint is, where this is coming in.
That's just fat.
It's in between.
Do you want to introduce yourself?
Hi, I'm Deanna.
AKA?
I'm the torturer.
And you're working on Cody today to fix?
We're gonna do hips, shoulders, and low back, mainly.
Just mainly maintenance work. It's nothing like... I do have a little bit of an issue with my shoulder that she can tell you about that we've been working on, but this is my typical, when I'm in routine.
Maintenance.
Like two massages a week is what I aim for. And she can kind of tell you a little bit of what she does and why I'm like addicted to not training before I get a massage now.
So with your shoulder, you've been having some pulling from the front that's creating an instability for his shoulder. So we're working on releasing all that so that he can get his shoulder strength back. And then his hips we're working on right now because he's starting to do some more with deadlifts and more weight. So we're gonna make sure that we don't get any injuries as he starts training harder.
Which will be pretty soon.
Yes. After all that food tomorrow, I'm gonna have to train really hard. We're gonna go... What is the place called?
Relish Burger.
Relish Burger, have you heard of it?
No.
It's in Boca.
It's on East Boca. They have a yak burger that...
What is yak exactly?
It's like a big giant bison looking animal. And apparently the meat is high in protein, very low in fat.
Yeah, it's super lean.
And flavorful, not gamey.
Where are they from, the meat?
Yakistan.
Yakistan.
Are you being real?
No.
It's just,
I was like,
there's a place called Pakistan. There's no place called Yakistan.
There's a lot of countries.
Oh, Cody. Are you being...
I wonder where they are.
We're going to edit that out.
No, we're going to leave that in.
Don't mind us, Leo.
This is normal, the Leo laying down.
He's emotional support.
He's smelling Cody's toes right now.
Like,
and he turned his head. Gotta wash your feet.
He's like, oh no.
Right now, were you stretching out his hip?
So what I'm doing is I'm opening all this up. And then we're kind of like a pin and stretch the way we're making the muscle contract and then stripping it. You had a rib pop there.
Was that a rib?
Yeah.
What happened? His rib popped?
Yeah, when I got up here, it just went right in.
Getting worked on too, I bet I feel, well, I bet a lot more stuff happens, gets online if I don't get worked on.
Oh, yeah, because, well, and not only that, but your training's not going to be as effective if your muscles are tight and you're not getting full range out of them. Then you're definitely not going to get as effective as a workout as if you had full range from that muscle.
Probably why I don't look as sexy as I should look right now.
And one of the benefits about a massage too that people don't even, well, I think about, but some people don't think about is you burn a lot of calories by getting all the toxins flushed and everything. So essentially I'm doing cardio right now.
Especially when you get a Deanna kind of massage because the sweat, the heart definitely increases.
Yes.
You recommend drinking, what, a gallon of water before a massage?
My go-to is half your body weight in ounces. And then obviously when you're training and sweating more, definitely need to increase.
Usually after massage I try to really push the fluids though because I can...
Yeah, after is the most important because you want to flush out all those toxins.
So what exactly does the cupping do?
So with the cupping, it's used for many different ways. We have some spots where I leave them stagnant, where I'm creating a pull on the muscle fibers and an extreme amount of blood flow. So then when I release them, the muscle fibers kind of get tricked into relaxing because it's been a constant pull for an extended period of time, and then all this blood flow flushes out whatever toxins were in the area. Then I also use them in like a stripping method to flush out areas, like I'm gonna use on his lats right now.
How long does the discoloration or the markings usually last?
It's usually like a person-to-person basis with like how they would heal with normal bruising, but usually like a week is like the go-to, I feel like.
And then you do it again, so they'll always have marks on them if they do weekly massages?
Yes, but sometimes you know, I won't, like, these areas have been done, so we probably won't go right back to them because we just did them, what was that, Monday?
Yeah, I mean, honestly, with the cupping, like, from my personal experience, I feel like it really allows the areas that she's working on to open up and, like, relax, like she said, because I've had areas that if she tried to go in right away,
You would hate me.
Well, I didn't really. I wouldn't
really
feel. I wouldn't feel the same relief compared to like the other day. I remember she cupped my lower back, and then like my lower back released really well compared to before. Just like a warm up, like a kind of a warm up. You know what I mean?
It definitely allows me to get more work done in a shorter period of time because you get to warm up the area.
Because a lot of like, not every body part, but some body parts are more stubborn than others.
Yes.
And need some warming up, like rear delts and lower back.
Your lats, so I always like to flush out. Hamstrings are a huge thing. Your calves.
They sound like a cheese grater. It's like.
Yeah, you can literally hear like gravel under his skin.
And what normally causes that?
So that's what basically it is the lactic acid and metabolic waste of the body that just gets, basically creates like cement on the muscle fibers. And they just get stuck like that until you either break them up, flush it out, and it just holds your muscle fibers in the contracted position, which is the knot that you feel.
So if someone's like worked out their whole life basically, and then just say, you know, they till their mid-30s, and then they get their first massage treatment, is it a lot of pain for that person because of just
usually, I mean, it's definitely going to be a learning curve because if they've never been worked on, they're definitely going to have 30 years, like you said, of training hard. So it's definitely going to be something you want to build them up to. But everyone's so different. It's really just depends on the person. Mind
and muscle connection has improved greatly. I know I've been getting massages for years and years, but I continue to be able to feel areas better just with like what she's saying, because some areas get so bound up you can't really feel them when you're training because your muscle fibers are like this. So when they're open and they have more blood flow, you can actually feel your training a lot better.
Especially with the way you guys train, you just sometimes it just builds up so much that you don't realize until you get that full range back how much you've been lacking. And I can't tell you how many times I work on people and they'll text me and they're like, I can't believe the pump I got, because they haven't had full range out of their muscles for so long.
Yeah.
You work on tons of bodybuilders, so you have a lot of experience.
Yes, I have a lot of experience with all of the big guys.
Yeah, that's the one thing too, is not every masseuse can work on big people. I feel like I've been worked on by a lot of people, and you got to be very selective who works on you, or more so who you put your trust in. If you're gonna, I mean, obviously you can go try somebody one or two times, but if you're not really, if they're not getting deep enough, or like, I don't know, muscle's just different for sure. Like if my mom went and got a massage, it's gonna be a lot different for the person compared to a bodybuilder.
A bodybuilder definitely.
Not every single masseuse is like good enough, really, I guess it was.
No, because you have to get really deep, because you guys are so dense. So it really does take a certain technique and patience to really get deep into those muscles and fully strip them efficiently.
Do you normally feel fatigued after doing a massage from a body compared to a regular person?
From a regular person, yeah. A regular person is like barely anything, but I think I've been doing it for so long on these guys that it's definitely something you have to build your endurance up to.
Yeah, you do.
Yeah, because we only do like 1.5 to 2 hour
Yeah.
sessions compared to a normal massage is anywhere from 30 to
Yeah.
90 minutes.
Yeah.
Just because 60 minutes is going to be like, okay, my left arm and then my back or something. It's not
Yeah,
gonna be-
I'd probably just get your, shoulders and
Yeah.
lats done and you'd be...
Not even like I'm that big a guy, but some of these people for sure, they're going to take like probably 3 hour sessions because they're so fucking big. Like Big Ramy, he's got to be like, he probably has like 2 or 3 masseuses on him at once.
Or NFL players, some of the linesmen.
Shit, can you imagine like Will Ford getting a massage?
Oh, yeah.
Like that, you have to get so deep on like a guy like that. Like, it's definitely.
I mean, on
skill.
the thicker, more denser guys, you're
Yeah.
definitely easily doing a 2 hour session to get a real effective full body.
And if you look up, most of those NFL players are getting massages too because they see the benefits from them.
Are there any stretches that you recommend or things that they could do before the massage to kind of help the effectiveness?
I don't usually recommend any stretching beforehand. It's not going to affect the massage much, and not many people have the knowledge to really effectively stretch on their own. I'm not a big fan of static stretching where you're just, static stretch is more just a constant pull where you're fighting it. I am a big fan of PNF stretching, which is like an active release type stretch where you're resisting against the movement. I find you get a lot more increase in range of motion faster, and with a static stretch your body's constantly fighting it and it's not always effective.
But the amount of blood flow after this compared to before is just like training wise is night and day. This is just opening everything up, right?
Yeah, this is great for tendonitis, and I also use this during like prep time with people to really break up anything in between any muscle groups so that you really get a better look with striations and everything.
Yeah, I'm a believer in that for striations and all that kind of stuff.
Oh, yeah,
Like,
during
the closer I get to a show, I've actually actually had like work done like 2-3 days out from a show, and when you're that like in shape, just one little tweak. Like I remember the girl, she opened up. I don't know what was happening. Like my glute when I would go back, like you couldn't see all the stride. Like I didn't have like striated glute on one side, and she like went in and it was locked up. I guess my hip or whatever.
Stripped
And
it
literally
out.
like no, it was just like one little tweak, and then I was able to pose right, and then my glutes look like night and day different. Like just from
one little thing.
tiny thing, because at that point you can't get any kind of deep tissue.
No,
you know what I mean?
you're strictly doing kind of like flushing techniques. Maybe like you said, a specific release to something
Well,
specific.
what happened is I think my glute had like turned. You know how like my tricep actually has a tendency to do it too, is my tricep turns to where it's not straight up and down.
Yeah.
So if it gets bound up, then you can't see all the striation at like that point. So I think that's what had happened.
Yeah,
with my
because you're not
glute.
able to fire it off correctly.
Yeah,
so
because
then
when
you're
I do
not
stairs, like I would kind of step wide, and she said it would throw off my hips, and then that would like fuck that glute up.
Exactly.
But that's how particular you can be with this shit because it actually works. Like do it like a couple days before your show and get like tweaked, and you can see like you can take a picture before and after. Like we used to take pictures before and after when I was getting ready for collegiate nationals, and it's just funny because you see the blood flow and everything. It's like you train too.
Thanks, Leo.
Loves it. I also think it helps just flush out. The sub-Q water between your muscle and the skin when you do get closer and stuff.
Oh yeah,
If you kind of
definitely.
massage.
Help release a lot of water.
Do you normally have a like a plan of attack before you come in from so you know what
So
you're
he'll
gonna work
tell
on?
me if anything's really changed, like over the past few days since I've seen him, how injuries have progressed or whether they've gotten worse, better, and different. and we work from there, and then we'll make a plan on what we're gonna attack for the day. Usually there's always a focus on his shoulders, lats and back, but always his hamstrings and calves.
Yeah, my calves have been probably, I think, the biggest issue for me this year. And I've gotten, you guys have seen the chiropractic work that I've gotten done on my calves. The electrostim that we got on video. I think the video's up, right?
I saw it on, I think it was on your Snapchat or something.
Oh, I thought you videoed, no?
No, he didn't do it that day.
Oh, what did he do the day that we went?
I can't remember, but
Well,
he
I
didn't.
got some electrostim done on my calves.
I
which
remember
helped a
seeing
lot.
that
Dry
on.
needling.
Yeah, dry needling. But definitely my calves have given me the biggest issue, and what I've come to find out, and it all makes sense now, but everything starts somewhere, and my calves are actually were the biggest issue, but I was having 10 different issues directly related to my calves. So once I figured that out, and you actually were the one that told me, I remember, and I felt like an idiot because I'm like, man, my hips hurt, my glutes hurt, my hamstring hurts, my quad, I almost tore, like this and that was happening. And turns out it's all because my calves are like so fucking tight because I'm training them all the time, trying to get big calves, of course. But you already walk on your calves so much as is. When you're training them 2, 3, 4 times a week on top of it, they get, at least mine get extremely, extremely tight. So
Absolutely.
that's been the biggest.
Well, because then they get tired because you're overtraining them, so then you're gonna
And
be a
what was
little more
happening
prone
is
to injury
my,
and pulling.
my range of motion was actually pretty bad when I would go down on my squat or deadlift or anything like that. So then I actually started pulling and pushing different when I trained.
You start recruiting the wrong muscles because something's not working, and your form goes off, and that's when you
Yeah.
become, oh, now my hamstring and my quad and
Yeah.
my hip and everything is messed up now because
I won't sit back on my squat as much. I'll lean more forward and then put a lot more on my lower back, hips, and things like that. So it's just, you got to train smart, and I always do train smart, but then I was training smart and stuff started happening. So I was like, there's definitely a reason. The biggest reason was because I was being a lazy bastard and I didn't get work done for like 6 months when I moved and got readjusted to like Florida living. I got a few massages here and there, but I just was never consistent with it. And since I've been consistent for probably like last 6 months,
yeah, you've been really good for the last
5
6
months,
months.
yeah. My training's been a lot better for sure. And although I'm not really big right now, I've been just chilling out. I feel like my body is in a good position for next year, so I'm happy. Even with my shoulder and everything happening, it's not like it's terrible. It's just little minor tweaks. That's it.
When we flip him over and we do his psoas, then you really get to see him make faces.
I've had that done.
Dude, that's the most painful shit.
That's when they move around your intestines.
Yeah. Your intestines.
I was like,
Close enough.
You're not supposed to be touching that area with fingers. So you're gonna work on the calves now?
Calves and hamstrings. So what I like to start with is the same way I was using the cup on his lats, I will do to his calves and hamstrings to flush them with some blood before we start digging around. And then there's certain key areas that we're gonna scrape. All of his attachments back here on the side. See, you can really hear the gravel there.
Yeah, it's crazy.
Did you hear that, dude?
It's really loud there.
It hurts too.
He never taps. He just cries silently when I can't see him.
Different moves. I just move around like when it's painful. That's what.
The sheet is always wet.
It's a sweat angel when he gets up. No.
Yeah, it's really red right there.
Yeah, it's breaking.
He's playing the drums now. Is that usually... Does he have like one calf that's worse than the other, or is they both shitty?
No, they're both pretty bad. I mean, do you feel like one's worse? I feel like they're both kind of equally in like
The right one has shit like this sometimes. I feel like, right? This isn't the first time.
Yeah, no, and it's the same spot.
Because I spike, I do a lot of my poses with my right calf like flexed. So when I actually pose and stuff, that's the foot I'm flexing more because that's the one I spike back.
So that's definitely the reason why that one's gonna always be worse.
Yeah.
Man, you look horrible.
It's painful.
All these dots.
These won't stay actually. These don't. The legs don't usually bruise. They will go away.
They'll stay on my front.
On your front?
Quads, yeah.
Because they don't usually. I don't
Not on the
usually see
hamstrings,
them
yeah.
on the hamstrings.
It
So
feels like a big ass pimple. That's what it feels like when you need to pop a pimple or something.
Mhm.
That's kind of what that it feels like because it's that painful. And
It's
people
like
know
that
how-
sore pimple until it's released, and then it's just
Yeah.
like.
Well, right now that's what it feels like because it's like getting sucked. Yeah.
so that should loosen it up significantly.
Yeah, so I'm gonna leave the cup on for a couple minutes, enough for the muscle fibers to kind of relax into the pull, and then I release it really fast, and it should let go with all that blood flow. And we'll just leave that there and move on to the next leg for a minute.
I hear that crunching.
Yeah, that's like
That's really painful.
the inside. How's that feel now?
Feels better. Yeah, it feels a lot better. Now it feels like I just had a cool mint.
It's just
York's peppermint patty.
Like peppermint patty, but just for my right calf. I'm giving the weirdest fucking descriptions today.
this is definitely
soothing.
the most
it's a big
interesting description.
it's just like a big pimple that you can't pop. That's how it feels. It's just
Like
painful.
my leg had a breath mint.
Like my leg had a breath. Yeah.
It had a pimple, and now it's just a breath mint.
Is that the inside of my teardrop, or is that something else like that one?
This one?
Yeah.
No, that's more on the side of the knee compared to your teardrop.
So is that like quad or is that ham?
No, it's the hamstring.
Oh my gosh! I thought you were pressing it. That's the thing.
Yeah, that's
Oh wow.
Hurts that bad?
No, it's just it's on a good spot.
It's just right
It's on a
on
really good
where
spot.
all those attachments go in from the side
I'm
of your
actually
knee.
pressing it because it's that.
It's
flexed
that
up.
tight. No, it's really tight. I can release it a tiny bit.
All right.
I'm trying not to twirl over. That's actually the spot that's injured.
Yeah.
Yeah, that's the
This
spot
is-
I hurt. So there's probably scar tissue.
Twisting's only gonna make it slip in even deeper.
So what spot are you putting your elbow on right now?
So it's kind of in between his quads and where his hip flexors are all tying in. So it's the very top of his quad and hip flexors. Okay, give me one good exhale.
And you're working on right now?
Hip flex psoas.
That's my favorite. Sucks. So basically, if you want to explain why that feels horrible.
It's like not.
So-
it's like not even that horrible. It's just awkward, but it's
Well,
like.
yeah, I mean, if someone's digging onto your
It's
through
like
your
getting
stomach
It's like getting
onto your
punched
spine.
without flexing.
So
That's the
this
best-
muscle is basically like this. It attaches onto your spine. So when you work from here to here, and so when I'm going in, I'm literally going through your stomach to touch the attachment on the spine.
Like
So
a
that
fatality.
is pretty much why it hurts.
Mortal
It's like hitting your
Kombat.
stomach. And then you try to flex your abs, but then you can't because
You have to try
when
and-
you flex your abs, then it shoots your hand out. So it's like you have to be relaxed. So it's like honestly trying to get punched, but being unflexed.
Yeah.
But it's your natural reaction.
Yeah,
is
it's
try
trying
be
to
flexed.
relax into someone's
It's just-
fist in your stomach.
Yeah, that's. Because what does that do? It comes down
So,
here and then it
yeah.
goes to the inside.
So no, you have a lot of other muscles that then
Yeah.
come through here. But what happens with this muscle a lot with guys deadlifting and everything is basically what this muscle's doing is this. So when it's short and tight, you feel the strain in your low back. You feel like something's resisting you. You can't straighten up. And it becomes so overpowering that you end up hurting your low back. So once you release that, you're able to then get a lot more strength and endurance back in your lifting for deadlifts and legs and everything, really.
And like, that's where I thought like some of the stuff was sciatica, and it was actually that, and then
because your
feels
back
right.
and your sciatica and everything in your low back is fighting against this because you're constantly trying to fight against the pull. So everything gets strained and tired in the back.
Is there anything that you can do yourself to help that, like maybe rolling on a medicine ball?
Rolling on the rolling pin or stretching of any sort. Anything's going to help.
You're going to want to stretch. For psoas, it's really hard because it's in your stomach. I know of a lot of people using like soccer balls and like literally putting it here, laying on your stomach and moving your leg so that you can release it. But it's a really difficult muscle to work on by yourself.
So you need someone like yourself.
Yeah.
Someone that knows what they're doing for sure.
Yeah, definitely. You don't want just anyone.
And that is another one of those that it ties into so many other things that it can lead to so many other issues if that is tight.
I've heard of people having like their acid reflux symptoms subsiding because it pulls so much that it creates like with their diaphragm, it creates a pull that they become like they're getting a lot of acid reflux, and as you relax that in the diaphragm, they don't get as much acid reflux.
Interesting. You work on his shoulder joint at the moment?
It's like in between his deltoid, but he's feeling it. It's literally right in between that front delt. Like,
Is it connective tissue or the actual muscle?
You feel it though, right? It's like
yeah. It's pulling great.
See, that's like why my shoulder's been hurting so bad right there. Oh my gosh.
See, it's all these little things that are pulling on his shoulder that's creating like an instability in it.
Goodness.
How long does it normally take to like fix a hurt shoulder? Because I remember I slept on my shoulder 2 nights in a row. Just weird position, and it took over 6 months for that pain to go away.
It totally depends on the injury.
It really just depends on how extreme the injury is.
Shoulders is such a weird thing
Yeah.
because like people use it so often.
Yeah, and a lot of people, you know, they have office jobs, so, you know, they sit at a desk like this all day, so everything's constantly pulling in their chest, so that it kind of re-aggravates things, which is a tendency with a lot of bodybuilders because their chests are so big and kind of over dominant that they get that same tightness, which then is pulling on their shoulder. It's just happening for different reasons than like, you know, the person sitting at the desk. So we gotta open all of this up.
It's painful because I did chest yesterday, so it's like sores.
Yeah, you're not usually this squeamish on the chest.
I think I'm just getting really sore too because I haven't trained hard in a minute, or like able to.
Yeah. Let me just strip out that bicep.
What is that? You just go over like a cord that's like.
Yeah, it's just because
I
the
literally felt
muscle
like all
fibers,
through.
like when you have one like little muscle fiber that's really contracted,
Right there.
as I strip it, it kind of like, almost like a rubber band, like snaps back before it lets go, and it creates that like nerve feeling.
Yeah, it feels like an electroshock or something. Sometimes. Like right there.
That looks painful.
It's not that bad. The neck is
No, and it like has a curve, so it kind of curves around his trap.
Yeah, it's not the worst spot for sure.
I feel like around the knee and everything.
Yeah,
and
that's
that
the worst.
definitely.
Oh,
Compare that to this, it's nothing. But it's still,
And it's so much
it's
more
still like make you
smooth.
cringe though, because it's like it is like a sharp. It's not like
It's I mean,
it's not like
still
a flat.
scraping.
It's not a flat surface, you know. It's like a sharp surface.
you like the human polka dot right now.
Yeah.
As if blood to the nervous system problems, serious
What's that first?
new or worsening
Push.
before treatment can test
Oh,
Jesus.
oh man.
His arms like it's about to break off.
Holy shit, that felt
That
good. That
needed-
felt really good. Oh man, I hope this one.
Okay, bring this. Yeah, push. Just a little more.
Yeah, that's good. That holy moly.
That side one.
Well, this one's good now. This one feels like it could probably go, but it's not gonna go right now.
It just.
That was big.
That was a
like
huge pop.
That was my whole shoulder getting replaced.
So,
Yeah.
so that's a wrap.
So
That's a wrap. So that's like what I typically try to get done 2 times a week.